There are a lot of chemicals that can be used to control microbial growth. So we're going to take a look at a lot of these different chemicals. We'll start with the phenolics and go through to the peroxygens. So these are going to be used as either antiseptics, which remember those are going to be used on living tissue to get rid of the pathogens, so we're not going to kill everything. Or they can be used as disinfectants, which are used on inanimate or non-living objects to get rid of the pathogens there. And remember, disinfectants don't kill all the microorganisms either. A few of these can be used for sterilization, but not many of them. So we'll point those out when we get to those. And as we talked about before, how well the disinfectant or antiseptic works depends on the concentration, how long you leave it on, if there's organic material present, so you want to make sure you clean up the dried blood, or maybe there's some dried vomit or something, so make sure you clean that off before you spray the disinfectant on. Temperature and pH can also affect how well things work as well. All right, all I want you to get out of this table here is that if something is a good disinfectant, it's going to be too harsh to use on living tissue as an antiseptic. And if something is a good antiseptic, it's not usually going to be strong enough to use as a disinfectant. So let's just take a look at an example. So if we look at glutaraldehyde and we look in the disinfectant column, it's got a high number 3, meaning that it's a pretty good disinfectant. So if you look in the antiseptic column, it's got a 0, meaning that we're not going to be able to use glutaraldehyde as an antiseptic. So it's going to be too harsh to use on living tissue. So you would not want to use that on a patient's skin or to flush out a wound or anything like that. And then if we look at the bottom here and we go down to chlorhexidine, chlorhexidine is a really good antiseptic. So we're going to use that a lot to scrub the patient's skin before surgery, or scrubbing the surgeon's hands before surgery. So it's a really good antiseptic. But you can see that it's got a 0 as a disinfectant. So it's not going to be strong enough to use as a disinfectant. All right, so our first chemical we're going to talk about are the phenolics. And all you need to know about these chemicals are just the things in red or that are italicized. That's all you need to know. So the phenolics, how they work to kill the microorganisms is they're going to disrupt their plasma membranes. And one of the phenolics, the first one that was ever used, is called phenol. The other name for phenol is called carbolic acid. And this was actually first used in 1867 by Joseph Lister. So remember, he was the English surgeon that developed aseptic technique, and he was looking around for something that he could put on the patients to scrub their skin with, wash the surgeon's hands with, and also put on the wounds after surgery to prevent infections of the surgery site. And so he looked around and he decided, hey, let's use this phenol, because this is what they're using to clean sewers out with. And he decided, well, this kills a lot of things, so let's try this. The problem with phenol is that it's made from coal tar, and it's very irritating to the skin, and it stinks. So eventually we moved away from that. But there are some derivatives of phenol that are still used. The derivatives are called phenolics, and also we have bisphenols. So just an example that you might run across is triclosan. There used to be a lot of triclosan that was used in the antibacterial soaps, and so you can see that on this label over here. And they actually took that out of the antibacterial soaps because we were developing a lot of resistance because it was being overused. You can still see triclosan being found in some products that they advertise as being antibacterial, like cutting boards or just other products that they might say, oh, these are antibacterial. So you might see triclosan in there. And then you can also see triclosan used in medicine because it's actually safe to use around the eyes. So if they're prepping for some surgery around the eyes and scrubbing the skin around there, you could use triclosan there. Okay, next we have our heavy metals. So this includes things like silver, copper, zinc, nickel, and mercury. And you can see on this Petri dish over on the right, we've got some of these heavy metals like this silver piece down here on the bottom. And you can see the bacteria growing on the Petri dish, and where the silver piece was, you can see the bacteria have been killed underneath there. So they do kill the bacteria. But the problem is that these heavy metals can be toxic to us as well. So we do need to be careful in how we use these. So generally they're not going to be given internally because of their toxicity problems. But they could be used topically, like there's this sulfur sulfadiazine cream. This used to be used a lot on burn patients, but unfortunately we have a lot of resistance now to the sulfur sulfadiazine cream, and so they generally don't use this too much in burn patients to prevent infections anymore. Listerine mouthwash, actually named after Joseph Lister. This contains zinc in it, and the zinc will help kill off some of the bacteria in your mouth. Copper sulfate, that can be used to kill off the algae in ponds. All right, our next chemicals, we've got the halogens. And if you remember from chemistry, group 7, so going down the periodic table here in red, here's group 7. So remember the halogens, halo is salt, gen to form. So these like to form salts. And these are very electronegative atoms, so they love to take electrons. So they're very strong oxidizing agents. So they like to go around and take electrons from things. And so that's how they end up killing the microorganisms, is they will damage things by taking electrons. All right, so our first halogen is iodine. And iodine is going to be used as an antiseptic. So we'll use this to scrub the patient's skin before surgery, for example. And you can also use this to scrub the surgeon's hands before surgery. And you can also use this to flush out a wound. So the one that's commonly sold in drugstores, you can buy betadine, for example. Betadine is what we call an iodophore. So the iodine has been complexed with an organic molecule, and that allows the iodine to be released slowly, and so then it doesn't irritate the skin as much. And so kind of the generic name for betadine is povidone iodine. Okay, so the povidone is just talking about the organic molecule that it's attached to. And so if you want to have something on hand to flush out wounds, clean out wounds at home, you can actually just buy the betadine at the drugstore. And you do want to dilute it with some water, just kind of make it a weak tea color, and then you can clean the wounds out. The problem with the iodine is that some people are allergic to it. So if you are scrubbing the patient's skin and you notice that they start to break out in a rash or hives, you need to wash it off and then go use something else to scrub their skin with. And the other problem is the iodine will stain the skin kind of a yellowish color, but it does wear off in a couple of days. The other thing is that's available is a tincture of iodine. And what this is we've got iodine mixed with alcohol. Okay, and the alcohol also has kills the bacteria as well. You can buy this at the drugstore, but I would not suggest using this to clean out a wound, because remember that alcohol really stings if you get it into an open wound. So I would not buy the tincture of iodine. I would buy the povidone iodine. The betadine would be a much better choice because it's not going to sting. Our next halogen that is commonly used is chlorine. So thinking about bleach, we use bleach to disinfect things like exam rooms. You can use it to mop the floor. We also put this into the tap water, our drinking water. They also treat with chlorine to help kill off some of the microorganisms in there. And then obviously there's chlorine in swimming pools to help kill off the bacteria there. And chlorine obviously will work the same way as the iodine. It will also oxidize things, so it will take electrons off things in the microorganisms, and that's how it kills it. You do need to be careful with working with the bleach. You can't use it straight because you could cause some burns on this on yourself if you get it on your skin. And you obviously never want to use bleach on your skin, so you wouldn't scrub a patient's skin with that. So you do need to dilute it with water and never use it on a patient's skin. The other thing with the bleach is it does like to attack brand new scrubs and ruin them. So be careful if you have brand new scrubs, because the bleach likes to go after that. Our last halogen is fluorine, and this is really important in dentistry because it will help prevent cavities, and it does that in two ways. So it will help harden the enamel on your teeth, because the bacteria in your mouth, some of them will do fermentation and produce acids which will soften the enamel, and once the enamel is softened, that can get eaten away eventually and form a cavity. So the fluorine will help harden the enamel again. And then also the fluorine does have some antibacterial activity. So it does oxidize things, and that helps kill the bacteria in your mouth as well. So we do find fluorine in toothpaste, and a lot of cities have put fluorine in their tap water as well. Alcohols are commonly used as an antiseptic or a disinfectant. We have isopropyl alcohol or rubbing alcohol. That's going to be used on the patient's skin when we scrub them for surgery, along with the povidone iodine or chlorhexidine, which we'll talk about a little bit later. And we can also use isopropyl alcohol when you wipe the patient's skin prior to giving them an injection like a vaccine. The ethyl alcohol we find in hand sanitizers, for example. You can use the alcohols as a disinfectant, for example, like wiping the top of a reusable bottle that you're going to be getting injections out of for several doses. You can wipe off with the alcohol there, just so you're getting rid of any microorganisms that might be there. So the way alcohols will kill the microorganisms is they will denature the proteins and disrupt the membranes. And then remember that the alcohols are part of tinctures. So if you have like a tincture of iodine, it's going to have the iodine plus the alcohol in it.